Early signs of liver disease most people ignore. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your doctor or a qualified healthcare provider regarding any medical condition. In this video, we are talking about the early signs of liver disease that most people ignore, signs that are easy to miss, easy to explain away, and almost always overlooked until significant damage has already been done. Your liver is doing over 500 jobs inside your body right now, filtering your blood, producing bile to digest fat, storing energy, breaking down medications, removing toxins, all of it silently, constantly, without a single complaint. Until it can't anymore. The terrifying thing about liver disease is that the liver has no pain receptors. It cannot tell you directly when something is wrong. By the time most people feel symptoms, significant damage has already been done. My name is Nurse Nose, and I am a registered nurse. My advocacy is simple. Every person deserves to understand what is happening inside their own body. Because when you understand your health, you make better decisions. And better decisions save lives. Stay until the end because sign number 6 is the one almost nobody connects to the liver, and it could already be happening to you. Sign number 1, your skin or eyes are turning yellow. This is called jaundice, and it is one of the most well known signs of liver trouble, but many people don't recognize it in its early stages because it can be subtle. Here is what's happening: the liver is responsible for processing bilirubin, a yellow pigment produced when red blood cells break down. When the liver is damaged and can't process bilirubin efficiently, it builds up in the blood and begins to deposit in the skin and the whites of the eyes, turning them yellow. Early jaundice might just look like slightly yellow tinged eyes, not the dramatic yellow skin most people imagine. Check the whites of your eyes in natural light. If they look more yellow than white, that is a sign worth taking seriously. Sign number 2, your urine is dark and your stools are pale. This one catches people off guard because most of us don't pay attention to these things, but they are important. Dark urine, the color of tea or cola, happens when excess bilirubin is being excreted through the kidneys instead of processed properly by the liver. The kidneys are picking up the slack, and the result is dramatically darker urine. At the same time, stools may become pale, clay colored, or grayish. This happens because bile, which gives stool its normal brown color, is not reaching the digestive tract properly due to liver or bile duct problems. If you notice both of these changes together, dark urine and pale stools, that combination is a significant red flag. See your doctor. Sign number 3, your abdomen is swollen, especially in the upper right area. The liver sits in the upper right side of your abdomen, just beneath the rib cage. When the liver is inflamed or enlarged, it can cause a feeling of fullness, pressure, or discomfort in that area, even without obvious pain. A more serious sign is a condition called ascites, where fluid accumulates in the abdominal cavity due to liver failure. The abdomen becomes visibly distended and feels tight, almost like a drum. People often mistake this for weight gain or bloating, delaying the diagnosis significantly. If your abdomen is swelling without explanation, especially in the upper right, get it checked. Sign number 4, you are exhausted no matter how much you rest. Liver related fatigue is one of the most common and most overlooked symptoms. It is not the kind of tiredness that goes away with a good night's sleep. It is a persistent, heavy exhaustion that affects concentration, motivation, and daily functioning. When the liver is struggling, it cannot efficiently convert nutrients into energy, cannot clear toxins from the blood properly, and cannot perform the hundreds of metabolic functions the body depends on. The result is a system wide energy deficit that feels different from ordinary tiredness. Many people with early liver disease spend months or years attributing this fatigue to stress, aging, or poor sleep when their liver is the actual cause. Sign number 5, your skin is itchy without a rash. Persistent itching without any visible skin condition is a classic and frequently missed sign of liver trouble. When bile flow is obstructed or the liver is not functioning properly, bile salts can accumulate in the bloodstream and deposit under the skin. This causes an intense, deep itching, often described as coming from beneath the skin, that does not respond to antihistamines or moisturizers. It can affect the entire body, but is often worse on the hands and feet. If you have been dealing with persistent unexplained itching that no dermatologist can explain, ask your doctor to check your liver function. Sign number 6. You are bruising or bleeding more easily than before. The liver produces the majority of the proteins responsible for blood clotting. When the liver is damaged, clotting factor production drops. The result is that even minor bumps lead to significant bruising. Small cuts bleed longer than they should, and you may notice bleeding gums or frequent nosebleeds. This is a sign of more advanced liver dysfunction, but it can develop gradually and subtly. If you've noticed you bruise far more easily than you used to, don't dismiss it as just getting older. Sign number 7. You are experiencing nausea, vomiting, or loss of appetite. The liver plays a central role in digestion, producing bile, processing nutrients from food, and clearing toxins generated by digestion. When the liver is struggling, digestion is affected. People with liver disease often notice persistent nausea, especially in the morning, a loss of appetite that makes even the smell of food unappealing, or vomiting that comes and goes without an obvious cause. Combined with fatigue and abdominal discomfort, these digestive symptoms are often the first cluster of signs that something is wrong with the liver, and they are almost always attributed to stress, a stomach bug, or anxiety before anyone thinks to check the liver. Sign number 8. Your mental clarity is affected: confusion, forgetfulness, or personality changes. This one surprises people the most. When the liver fails to filter toxins from the blood properly, those toxins, including ammonia, accumulate and begin to affect the brain. This is called hepatic encephalopathy, and in its early stages, it can look like mild forgetfulness, difficulty concentrating, subtle personality changes, or mood swings. Family members often notice the changes before the person themselves does. What looks like stress, depression, or early dementia can sometimes be the liver failing to do its job of protecting the brain from toxic buildup. This is a serious sign that warrants immediate medical attention. Sign number 9. You have spider like veins appearing on your skin. These are called spider angiomas, small, web like clusters of blood vessels visible just under the surface of the skin, usually on the chest, face, or arms. They get their name because they look like a tiny red spider with legs spreading outward from a central point. A few spider angiomas can be normal, but multiple spider angiomas appearing across the body, especially combined with other signs in this video, is a recognized clinical indicator of chronic liver disease. Now, what do you do if you recognize these signs? If you are experiencing two or more of these symptoms, see your doctor and ask for a liver function test, also called an LFT or hepatic panel. This is a simple blood test that measures enzymes, proteins, and bilirubin levels to assess how well your liver is working. Key values include ALT and AST liver enzymes that rise when liver cells are damaged. Elevated levels are often the first measurable sign that something is wrong, even before symptoms appear. Other helpful tests include a liver ultrasound and a complete metabolic panel. The liver is one of the only organs in the body capable of regenerating, but only if damage is caught early enough. That is the window, and that window closes. As a registered nurse, I have cared for patients who came in with advanced liver disease that could have been caught and slowed years earlier. The signs were there. Nobody knew what to look for. That is why I created this channel, because this information can genuinely save lives. If this video helped you, please like it and share it with someone who needs to hear this. Subscribe for weekly health education from a registered nurse who genuinely cares about your well being. Take care of your liver. Take care of yourself. I'll see you in the next one.